Assalamualaikum dan selamat pagi. It's not yet good afternoon yet. I think we will be reaching good afternoon in a short while at the end of this particular session. Those of you who have been following this morning, you will know that we started off with an introductory welcome remarks by the chairman of the Advisory Council of Economic Club of Kuala Lumpur, Tan Sri Abdul Wahid Omar, giving us a good perspective of what the status of the economy is, how we are shaping. No doubt COVID impacted us in 2020, and we are almost into 18 months or 20 months, depending on when is the first dose, of, not the dose of the vaccine, but the first dose of the infection came into the country, although it has been earlier elsewhere in the world. So we looked at it as if it is one of the other infectious diseases that we have confronted over the period of time, depending on which age you are. Then we suddenly realized that COVID is not going to go away. It is there. At the end of 2020, we have not won the battle yet. The battle is ongoing, not only in Malaysia, but elsewhere in the world. And the sort of experiences that seems to be coming forward were not very encouraging. So we moved into 2021. The question that arises, I think the people who framed this National Recovery Summit and then component parts themselves asked this question: are we winning the war against the COVID? I think if you look at the global, so many wars we have won. Is there a road to recovery? Yes, I think the minister made it very clear how we are progressing on the road to recovery, and what are the pitfalls, and what are the strengths that we can put into, and he has outlined it, including the budget for 2022. I think more to come, apart from what has taken place in 2020 and also in 2021. So we are here to address from a sort of a panel that is composed of different people. I think we have Mr. Hishamshah, the Deputy Director General of the Ministry of Health. He would probably give us an insight into what is happening really on the technical front, battling the COVID, because they are in the front line. Whether it is the lack of resources, as we talk to the minister, the budget is always very, very big, both development budget as well as operational budget for the health sector. Yet we found that our infrastructure and the human resources related to the healthcare system were not that good to address this COVID pandemic. Then we have got industry people. We have got in the health sector, we have two people actually. Dato Dr. Kuljit Singh. I need not have to give them the profile because they are all well-known faces. When the pandemic struck and then the issues were being addressed, many people came forward. Tan Sri Nur Hasham of the DG of the Health Ministry was a common face, everybody knew. Dato Hishamshah, we didn't see him much, but today we will be hearing quite a bit because he is going to be the person in charge of the research and technical side. So the minister also outlined looking at, we are going to do some genome sequencing, and we are also going to look at some vaccine production, and then also beginning to see how the variants will play out when the pandemic is being contained. Then we have got a very welcome face here, Sheikh Nadiah, and she herself is in two areas. One is, of course, Executive Officer of Thomson Hospital, another frontliner, and also is looking at the Group Chief Executive Officer of TMC Life Sciences Berhad. So they are into some aspects of the research, and more importantly, and the industry perspective will be given by Tan Sri Dato Thian from the Federation of Manufacturers, Malaysian Manufacturers. And he has got a lot of things. And then earlier in the discussion with the Minister of Finance, although the charting forward is very clear, but you will be able to tell from the health and the economic perspective, the ground facts may not be equal to what is being done. Although the minister has said we are going to be data driven. We look at the data and then we are bringing out the policy and the action programs on that basis. So with that, we just want to see where are we heading, and then you will be able to give us. The basic question on the man in the street is asking, am I safe? This is a question, and we have to give that kind of an assurance, whether at home or on the road or in the working place or even at the hospital. Am I safe? That seems to be the sort of problems on the thing. And the next question that is being asked, even after vaccination, am I safe? These are sort of a perturbing questions. And while we are waiting for Dato Dr. Hishamshah, Mohamed Ibrahim, maybe I would like to ask Tan Sri Dato Thian to take the floor, and he has got some slides as well to share with us. And I would see that about 7 minutes or so each of your presentations, so that we will have more time for interaction and also to take some questions from the floor. So with that, can we go on to invite Tan Sri?
Yes.
It is all yours now.
Thank you very much. A very good morning to everyone. Yang bahagia Tan Sri Abdul Wahid, yang bahagia Dato Seri Mohamed Iqbal, yang bahagia Tan Sri Michael Yeo, and all speakers and all participants. First of all, thank you to the organizer, KSI Strategy Institute, for inviting FMM to share on how the manufacturing sector can work together to achieve the national recovery plan. Ladies and gentlemen, the resurgence of COVID-19 infections due to the new and more virulent variants of the virus have resulted in multiple lockdowns to break the chain of infections. The industry understands the need for the government to institute the lockdowns to break the chain of the infections, which were rising exponentially and also putting a great strain on the national healthcare systems. But we had been locked down for too long, and we have many MCOs, which was devastating. We know that the manufacturing sector is one of the main sectors, especially essential sectors, allowed to operate amidst the ongoing national recovery plan. Given its significance to the economy, as evident from the fourth quarter 2020 economic performance, the manufacturing sector has been the pillar of economic growth, where it was the only economic sector with a positive growth of 3%. And this performance continued in first quarter 2021 with stronger growth, where manufacturing led all other economic Yeah, this slide. Yes. Like all other economic sectors, with a growth of 6%. And again, in second quarter 2021, where the sector registered a growth of 26.6%. But the third quarter yet to see. In addition, the sector has continued to contribute around 23% of GDP, including 86% of total exports, and is the main source of demand for output from the other economic sectors. The operations of the essential sectors, especially the food, beverages, and healthcare products, have ensured that the Rakyat continue to have supply of food and medical supplies during this lockdown. Amidst the resurgence and the spike in cases, the industry has been doing its part to ensure continuous strict adherence to SOP, which have now been ingrained as the new normal. The industry also continues to enhance preventive measures, including testing of workers to ensure that the workplace remains safe for all employees. However, it has become more challenging to manage the entry of infections into the factory or hostels due to the asymptomatic sporadic cases, which now make up the majority of cases. It was also very unfortunate that the categorization as workplace clusters whenever positive cases are detected at the entry of the premises has led to wrong perception that factories are the main source of infections. Actually, it's not. Regardless, the industry continue to take all the necessary steps to ensure that the cases are detected early and safely to ensure minimum infections at the workplace. The industries understand the necessity to have a comprehensive national recovery plan as an effective exit strategy for the COVID-19 pandemic, which has continued to plague the nation since early 2020, almost 20 months now. Worker safety and health are always a top priority, as without the workers, no business can function. The fact, however, remains that businesses cannot be sustained if operations continue to be closed or are reduced in capacity for a prolonged period, as it will lead to negative knock-on effects in the economy due to the extensive supply chains and the network involved in manufacturing. If industries remain closed for too long, it could cause economic stagnation and irreparable damage, including possible exodus of foreign investors and reduction in domestic investments. We urge the government to open up all economic sectors under one phase. No need to have phase 1, phase 2, phase 3, phase 4. Under one phase called recovery phase. And do away approval letter and just based on vaccination rate by using digital certificate as criteria. And also apply more standardized SOPs and follow this strictly. We need the government to standardize the thousands of SOPs into a simple recovery SOP that is based on activity base. For example, indoor activities or outdoor activities. We should not have so many SOPs that confuse everyone. It is globally evident that fast rollout of vaccination is the key to reopening and the revival of economies, regardless of the continued threats of resurgence of cases. In this regard, employers in the manufacturing sector, through the PICAS or Public-Private Partnership COVID-19 Industry Immunization Programs, have been aggressively ramping up their company's level of vaccination to ensure the safety of their workers to return to normalcy in businesses, operation, and sustainability. We know that on September 7, 2021, 935,123 employees under PICAS program have been received their first dose, while 772,363 have received 2 doses alongside the others who have also received their vaccination via the National COVID-19 Immunization Program, PIC. As of September 6, 2021, based on the JKJV updates, 68.8% or almost 70% of the adult population in our country have been fully vaccinated, and 88, almost 89% have received at least one dose. These are the most encouraging numbers towards achieving the targeted herd immunity and further easing of restrictions for business and economic recovery. Next slide. Ladies and gentlemen, the tightening of the COVID-19 lockdowns has taken a toll on business performance, with business activity plummeting in first half 2021, as shown by FMM MIR Business Condition Index survey. The outlook for the next 6 months remains lackluster, as evident for the FMM MIR survey. Business activity is expected to remain slow, domestic and export sales to remain weak, drop in production, volume, and capacity utilization. Slowdown in capex, employment is expected to be generally flat, while cost of production is expected to rise. Therefore, it is paramount important to work together as a team to achieve NRP by opening up all economic sectors now and have all the necessary support from the government. Next slide. With the bleak outlook, the industry has thankful for the easing of the restriction of operations. This is the only hope that introduced from August 16, 2021, in line with the acceleration in vaccination rates, where economic sectors have been allowed to resume operations based on the status of their full vaccination rates, irrespective of the state or NRP phase that they are operating in, and doing away with the distinction between essential and non-essential sectors. It was an eagerly awaited and welcome decision. The next 1 to 2 years will be a very challenging, as financial reserves have depleted, cash flows remain constrained, operations are based on more stringent requirements, including higher operating costs. Markets have been severely impacted due to lockdown period and inability to meet orders. Support and assistance must continue for businesses to regain their footing towards recovery and building their resilience during this fragile period. In this regard, FMM sees the coming budget 2022 and soon to be announced 12 Malaysia Plan, RMK 12, as being critical to the National Recovery Plan and revival of the economy, given the gravity of the impact of this latest round of lockdowns has had on businesses and the economy. These coming 2 years will be a critical recovery period for most companies, having to rebuild their businesses and implement specific strategies to regain competitiveness and sustainability. Now, Budget 2022 initiatives will be a key to address some of the more immediate remedies for recovery, such as addressing cash flow constraints and helping companies regain market share, especially export markets, as many have had their markets impacted due to business closures and inability to meet their contract obligations, including termination of contracts by key customers. Improving investors' confidence level is another core area which Budget 2022 will have to focus on, as it has been severely dampened. Employment-related initiatives must be continued to ensure that unemployment levels are at manageable level and to ensure that those who have been displaced are able to upskill and reskill and find new jobs quickly. There is also an urgent need to continue to drive businesses transformation, technology and digitalization adoption, productivity enhancement, and innovation, which are critical to rebuilding resilience and reform the economy. Lastly, equally important is the need to keep regulatory costs burden low during this recovery period and to postpone any planned increase in regulatory costs. The 12 Malaysia Plan, on the other hand, will focus on more medium and long-term recovery policies and measures to transform the economy from the impact of the pandemic on the overall business ecosystem and future-proof against any other future occurrence to ensure continued global competitiveness. We look forward to a more long-term measures to support the manufacturing sectors and industries as greater transformation needs to take place to move towards high technology and high value-added products and operations. We anticipate a steep acceleration in the adoption of Industry 4.0 technology and digitalization as the COVID-19 pandemic has accelerated these changes by several years. Human capital support is another critical area in the recovery process, including having a more comprehensive manpower plan with greater focus on building a demand-led TVET ecosystem, moving towards more implementation of automation and building the talent to support a more innovative environment. Next slide, my last slide. Lastly, it is imperative that all policies and measures introduced as part of the NRP to aid the recovery of businesses and the economy adhere to the following policy guiding principle. That means that the government policies must in sync with the private sectors to ensure that it is implementable, effective, and result in a win-win outcome for all and address the expectation of the industrial sector during this critical period for all. What we mean is that the government policies must have these 4 C's policies. The first C is calibrating policies to shape our country. It means that it must be practical and pragmatic. The second C is clarity. It must be very clearly defined. And third C is consistency, no U-turns, no sudden shifting of goalposts, and all this. And the fourth C is a certainty. It means that you must publish and get at it so that everyone knows. And in conclusion, the industries hope that the government can fulfill the industry's 4 I's, 4 improvements. The first is the government should improve the economic growth by focusing on generating better revenue and lower cost of doing business. The second improvement is to improve well-being of people by focusing on enhancing the purchasing power and lower cost of living. The third improvements that industry expect is to improve confidence level of both foreign and domestic investors by focusing on right policies, also strengthen the capital market, and also strengthen our currency. The last improvement that industry expect is improve institutional reforms, especially by focusing on anti-corruption and betterment of government administration efficiency. Ladies and gentlemen, this is our FMM presentations on the.
Thank you, Tan Sri. That is very, I would say, a mouthful of observations and some suggestions that has come. And I would say that this is from the ground facts. From what we have seen earlier from the minister's presentation, I think his concern is the same, whether it is the industry's concern or whether it is the riot's concern, the concern is the same. But how do we approach it? And what you have outlined through your slides and so on is the ground facts don't jive with what the government is saying, the data-based information that is prompting for policy guidelines and so on. So we need to bridge this so that they take cognizance of what is going on. And it comes in number 1, the recommendation for the SOPs, the multi-SOPs that is taking place between different departments and different ministries and different industries, I think you need to have, as you rightly pointed out, a rationalization. And maybe you have to drop the word SOP and introduce a new term that is common to everybody. I do not know, maybe the Ministry of Health may suggest something like COVID compliance rule or something like that. We can look at it so that it becomes very systematic, that everybody will have to do the compliance, COVID compliance rules. Yes, I think your 4 points, credibility, consistency, clarity, and certainty is very important. Thank you very much, Tan Sri. Although you have taken a little bit more time than the allocated time, but it's very well done. I think that is the important contribution you have made. Now we have already with us Dato Dr. Hishamshah Mohamed Ibrahim. Welcome.
Yeah, thank you for having me.
Yeah, okay. Nice to see you. I think just to brief you, this morning we have had, I do not know whether you had time to look at what the minister said, and even our chairman was able to give some perspective. But health is the most important factor. I think everybody acknowledges that. And your ministry is playing a very important role, no doubt. And you're in the front line, both in terms of delivery and also attack. If everything is not going right, then the Minister of Health is to be blamed. So with that, I think we are looking forward to your contributions in this National Recovery Summit. And you are privileged to have you because you are research and technical support. So give us some insight as to what has happened is not so important because public knowledge. What is likely to happen and where do we go in the health frontier to contain the pandemic and so that the economic recovery can take place very strongly? Over to you, sir.
Yes, thank you, Datuk Sri Chair. Apologies, I couldn't join in earlier this morning because I'm in another summit addressing the governing board member for the CMO TROPMET. So these are our colleagues from Southeast Asia and also Western Pacific discussing on the current topic at hand, the issue on COVID-19 pandemic across the region. Distinguished speakers and guests, ladies and gentlemen, Assalamualaikum and very good morning to everyone. I'm very delighted to be here this morning to join the session discussing on how can we work together to achieve the National Recovery Plan. I would like to take this opportunity to thank the organizer, the KSI Strategic Institute for Asia Pacific, for inviting us to share some of our thoughts on this matter and also this future. I was able to listen in to Tan Sri Datuk Sir just now from the FMM perspective. I think this is very important perspective from those bordering on the strategy for the how can we kickstart the livelihood aspect of the pandemic 19 strategy. Okay, when you look at the impact of the COVID-19 pandemic, it has highlighted the vulnerability of our health system, not only in Malaysia, but across the world. Because our healthcare system has been tested beyond the normal at extraordinary level. At one point, we do not have that number of beds or the critical care beds that we need to handle the pandemic. But over the past couple of months, we have upscaled our capacity to double or sometimes triple the number of beds that we have. So that has actually given a very tremendous strain to our frontliners and to our healthcare system. The other thing that this pandemic has reminded us is that public health crisis is not the domain of the Ministry of Health alone. Please, I think this pandemic has demonstrated that this is an issue that would affect the whole of society and has affected the whole of our government. I think this is something that we need to be very aware about, that health is something which is pervades all of our community, and it is not the domain of a single ministry. I think we need to be on board together as a nation to handle this pandemic. So, ladies and gentlemen, I think you can be are quite aware that we have been facing the third wave of this pandemic since last September following the Sabah election, and we have not seen our numbers coming down. And as of yesterday, the number of cases that we have recorded daily, yesterday it was beyond 19,000, and the number of total confirmed cases in our country is now beyond 1.9 million cases. And the number of death rate that we have recorded is now beyond 19,000, although it is still about 1% of the total number of cases, and it is lower than the world average of about 2.6 or 3%, but still that 1% death is, I think, something that is actually quite high even from our standards, and we are very sad about this. But however, consequentially, the government, taking into consideration the impact of life, there's a lot of moment control order that has been taken place in our country. And because we also now are grappling with a different strain of virus, my colleagues, previously the original strain from Wuhan, the reproductive number, the R0, is only about 2 to 3 or 2.5. One case can infect 3. But the current Delta variant is a totally different virus in a sense, because the R0 now can reach about 9. So one case can infect 9 other individuals. So the R0 has actually increased so much. So that has actually, moved the goalpost, so to speak. So previously, if we wanted to actually get herd immunity of about 60 to 70% is quite adequate. But now with the changing variant, we need to have about 90% of our population to be immunized or protected before we can say that herd immunity has been achieved. So that's why now we are moving away from herd immunity, but we are moving to the idea of living with the virus with certain way of new norms that we need to be able to handle nationwide. Yeah. And one of the key agenda that we have used quite successfully in response to the COVID-19 pandemic is trying to immunize the whole of our population, those that can be immunized. Up till recently, about more than 70% or 80% of our population now have received the first dose, and we are targeting that by the October we need to immunize as high as 100% of our total adult population. So that is what we are trying to achieve. During Merdeka time, about 40% of all of our states have achieved that 40% immunization rate. But now we are ramping up to 60%, 70%. And now by October, we hope to achieve 100% of immunization in our adult population. And as we speak, we have started immunizing our adolescent, 12 years and above. First, those who have got some comorbidities, the high-risk cases, and subsequent to that, the 16 and 17 years old are also going to be immunized. And we're going to actually do that gradually to the younger age group. We need to do this because we think by immunizing our youngsters, our adolescents, we can cut down on the number of cases that we're seeing more in the younger population as we speak. So that's something that we need to do in the coming months. Yeah. Ladies and gentlemen, the National Recovery Plan consists of 4 phases, as you are well aware, and each phase would be based on 3 main indicators to move from one to the next. Yeah, the threshold indicators. Initially, it is just the number of new daily cases, but we are in this process of probably using the category 3, 4, and 5 as a more accurate representation of the numbers that we can use before we move to the next phase. Because with the immunization, we can have people in the category 1 and category 2, but we have less number of cases in the category 3, 4, and 5, which would require our hospital system to support them. And I think probably this would have replaced the initial indicator, the daily number of new cases. So that's one thing. The other thing that we need to use is the parameter of how is our intensive care beds being utilized. Are we at the level of beyond 80%, or are we now at 70% where our system can handle the spike of cases that may come from time to time? So the other indicator that we have agreed to use is actually the vaccination rates, and we are happy to note that the vaccination rate has actually gone beyond our initial estimates, and it has actually much better than what we have set ourselves to do. So in terms of what are our role in this pandemic, we are trying to strengthen the healthcare response to the pandemic, taking into consideration the initiative of collaboration between the government, the whole of government, and also in the whole of society. Because now the frontliners is not the medical care personnel now, it is actually back in the community. They are the frontliners, the community leaders and business organization who need to take precautionary steps to prevent virus transmission. It is not at work or place only that is very important, but more important is when they get home to their place of dwelling and how they interact in the community. Those must also be coupled with the new norms of wearing masks, avoiding crowded places, and physical distancing, and good ventilation, so that we can cut down on the transmission of this virus. Cutting down on this transmission of virus are going to cut down on cases, and it's going to reduce morbidity and mortality in our people. And breaking down the transmission of this virus, we are now increasing the capacity of our COVID-19 testing, not only from the traditional gold standard RT-PCR, but now we've got available, we have set up the ceiling price and make it available of the RTK antigen self-testing kit. It is less than 20 ringgit, where previously it was almost about 40 ringgit, which is quite expensive. And we are looking at how can we have this self-testing kit available to the B40 groups by using some of our programs in the PK B40. We're trying to get funding so that we can provide self-test kit to our population so that they can test themselves and isolate themselves once they are being detected to be positive. And these are among the strategy that we're trying to do so that we can diagnose the COVID-19 as quickly as possible, so that we can identify cases, then we can isolate them, quarantine them, and give them support. And if they deteriorate, we can bring them to hospital quickly, and we can prevent them from deteriorating to category 4 and 5, where they would need ICU support. Yeah, and the capacity of our labs have increased tremendously. We can now do RT-PCR beyond 120,000 per day, and majority of these labs are in the private sector, and we've outsourced the testing of most of our RT-PCR to the private sector, so that they can help out with the public labs, where we need to handle a lot of the other cases coming from the pusat kesihatan as well as the hospital. Yeah, so the self-testing kits is being made available, and I think in the coming days, this would be very important for our population to take it upon themselves to have the testing done at home. And the contact tracing is now also being led by technology, whereby we are trying to use enhancing the MySejahtera apps, and also we are using some devices so that we can make sure that we can use the technology to quickly trace contact when they happen, and so that they can be alerted and they can be tested, they can be traced, they can be isolated, and they can be treated quickly through the use of digital technology. This is a dynamic situation whereby we are going to use the digital platform to do this. And even in the quarantine at home, we are now trying to pilot out locally produced devices whereby they can wear these wearables, and we can detect them within a certain area in the quarantine place. And we can also use some of the biosensors to send in some information for those who are being quarantined at home, monitoring at home. And this data is going to be channeled to a control center that can monitor the progress of these people at home. So these are some of the things that we have done in the Greater Klang Valley, and we are going to enhance this further in some of our centers, because Greater Klang Valley has seen a very good upsurge of vaccination, and the number of admission, we are seeing a reduction. So is the number of cases and death, and also the cases with the severe category. This is coming down. We are replicating some of the measures that we've taken in Greater Klang Valley to the other states that's facing an upsurge of cases. So this is something that we are doing. Yeah, we need to also look at beyond the COVID-19. So where we need to be prepared for the pandemic that's sure to come in future, and these measures would be something that is very important to make sure that our country remain prepared for any eventualities in the future. And our workforce, we are looking at increasing the capacity, and we are mobilizing our workers where they need to be, and these are among some of the things that we are doing to handle the necessary workforce, which is quite crucial for handling the cases, especially in the front line and in the fields. Yeah. Unfortunately, the treatment options are not that many. We in Malaysia have been actively involved in a lot of clinical trials in treatment, in the WHO COVID-19 solidarity trial for treatment, and we are also now using baricitinib, the new drugs, and we are looking into some other drugs which probably are going to get EUA approval soon, and we're discussing with the manufacturers so that, like vaccine, even before they are registered in their country of origin, we have started doing discussion with some of the manufacturers so that we can have access to this therapy as soon as it's being made available under the emergency use authorization in the country of origin. So you're looking into that, because at the moment, the armamentarium of drugs that we could use to handle people who are with COVID-19, the severe categories, are not many. So that remains a challenge to us as well. Yeah. So those are amongst some of the things that we are having at the moment, because we know that the public health facilities can't cope with the number of cases that we are seeing within our network. We have now engaged with the private healthcare facilities. A lot of the cases, the non-COVID cases, are also being outsourced to the private hospitals so that our non-COVID patients still get the care that they need. This would include urgent and also semi-urgent cases, elective surgeries, whereby they cannot wait a long time before they get the treatment in the hospital. So we have allocated funds for this also in the next couple of years for us to utilize our private healthcare facilities to help us with the non-COVID cases. Of course, they are also handling the COVID-19 cases, but not as many as the public health facility. We are handling that in the majority of cases, but we are sending out and outsourcing the non-COVID cases to the private healthcare facility. So with regards to immunization, I think on hindsight, we have done a good thing by securing strategic vaccine sources by having this JKJAV, Jawatan Kuasa Jaminan Access Vaccine, which is co-chaired by our then Ministry of Science and Technology, mostly, but now he's our Minister of Health. They've switched places, and we are going to still have this JKJAV, and the CTI. The committee looking into the vaccination is going to be moved to Ministry of Health come October, where we are going to actually continue this effort. And we are also very grateful with the science diplomacy effort by the Minister of Foreign Affairs, whereby we also have got several million doses of vaccine from benefactor countries. Yeah. And we are increasing our capacity of the vaccination rollout by utilizing our 100% owned Sindrian Berhad company, Protect Health Corporation. They are the one that has been onboarding a lot of our GPs and onboarding a lot of our private hospital to initiate the PPV, Pusat Pemberian Vaksin Swasta, and the mega vaccine centers. This is being coordinated by the Protect Health corporation, Seri and Berhad, under the Ministry of Health. And this is looking forward, whereby we hope that all of the GPs that have been onboarded during the PICK program, program Imunisasi COVID-19 Kebangsaan, they can take over the role of being the family physician for people in their locality. So this is a part of our strategy in strengthening the public and private partnership. And as we wind down the big PPVs, Pusat Pemberian Vaksin Mega, and all of those big centers, which cost a lot of money to sustain, we are going to be reliant on a lot of our colleagues in the private sectors, the GPs, the network of GPs. We've got close to about 7,000 GPs or probably more, and they are going to be shouldering the effort initiative of giving booster vaccination if it becomes necessary, and also they are going to be part of our greater initiative of empowering the private healthcare facilities in helping out to look after the care of our patients in the community. So we are also looking at the application of several platforms, whereby using of My Sejahtera to give information to the public with regards to the vaccine experience, any adverse events, and any new information. So we have got these super apps. Before this, we do not have a application that is being utilized by a lot of our population, but My Sejahtera is the #1 application that has been downloaded by our people, and it has been proven very useful for people with regards to the handling of COVID-19 information, and also vaccination. And now we are having this vaccination certificate in My Sejahtera. So, ladies and gentlemen, the National Recovery Plan outlines the measures to control the pandemic and progressively reopen society and economy. Some of the issues that we think needs to be addressed would be looking at, do we need booster vaccines? Yeah, and then also policies to incentivize vaccination. And we need to make sure that research in the country can be heightened, so that we become self-sufficient in local vaccine development. And we also need to make sure that there is requirements, if there is requirement for travel and digital vaccine, how can we collaborate with other countries so that one vaccine certificate in a country would be accepted in other countries as well, because there is issue of vaccine approval and recognition worldwide. So this needs to be addressed as well. Yeah. So we also would need to be very cognizant of this mutation that is coming on board, variants of concern. Now it is a Delta variant, there's a new variant, Lambda variant, and so on and so forth. And these are something that we need to be very cognizant about. And the other thing is, can our society be, doing these new norms in a big way, adopting the new norms? And we need to look at the ventilation standards, because we know that if the ventilation is not good, and the chances of this virus being transmitted by the airborne way is not going to be helped. So we need to look at new strategies to look into healthcare facilities and workplace facilities and industries, so that they make sure that the ventilation in their workplace is up to the mark. Yeah. Last but not least, Ministry of Health is committed to working with everyone towards the recovery of our nation. And let's work together, because we are, on this thing together, and we hope to see better days ahead. Thank you very much for your attention.
Thank you, Dr. Hishamshah, Dr. Hishamshah. That was quite an informative presentation on what your ministry is doing. I have some burning questions to ask, but I think we want to finish off the other two speakers. But I think it is important for us to take recognition that what you have said, health is not only a matter of concern to the Ministry of Health. The pandemic has proven that it is a matter for everybody. And so you have to rope in every aspect of the nation in order to contain, and that we need to have a cooperation in order to do that. Now we have two more speakers, and we are...
Can I raise one question very quickly, if you don't mind, Mr. Moderator?
Yes, Tan Sri Abdul Majid, you are privileged person, so you can ask the
I'm a
question.
little bit concerned. There's a shortage of ICU bed in Sabah. Not only ICU, I understand that there's even a shortage of ordinary bed in the general hospital. I would have thought that the government should have solved this problem by now, but there appear to be still the shortage. And I'm wondering whether it will be possible for the Ministry of Health to ask the private hospital to assist in meeting this shortage. There are a lot of private hospitals in Sabah. If you can ask for their cooperation, but they charge nominal fee for these people. I mean, especially from the company, they cannot afford the types of fee that the private hospital is charging. But I would have thought that the private hospital should make some sacrifice in order to ensure that these people are being attended to. The other question I want to ask is, Sabah is very much behind in the vaccination program. I read that the minister was there 2 days ago. He's making some effort. But when do you expect to reach the herd immunity as far as Sabah is concerned? Thank you.
That is a very, what do you call, once a Sabahan, always a Sabahan. Yeah, Dr. Hishamshah, you want to respond quickly to that?
Yeah, Tan Sri Majid, I think very good points. I think we are aware of Sabah and Sarawak. So that's why our minister, the first state that he goes, recently is in Sabah. He went with our Tan Sri KPK as well as our Datuk to look a first-hand account of what's happening in Sabah. As you rightly pointed out, we have been utilizing the private hospitals for our non-COVID cases. We have, sent cases to them for outsourcing of some of the cases. But of course, this can be enhanced further. And I think your point. But beyond just outsourcing to the private sector, we're also looking at, building probably more ICU beds and more hospital beds so that we can, handle the situation in Sabah or in the other states as well. But beyond infrastructure, we need people. Manpower is something which is actually still, not only the doctors, the other support staff is crucial. At the moment, we are still lagging in terms of the availability of manpower. Even if we build hospitals, but we don't have the nurses, the number of support staff to be the workforce, it is not enough. So those are in the bigger picture. We know that we need to beef up the capacity of the healthcare system in Sabah and Sarawak. It is so much better, and I think the pandemic has clearly shown that we lack in that area, and we are taking steps to address this, Tan Sri.
Thank you, Dr. Hishamshah. I think what I would like to suggest to Tan Sri Abdul Majid is that your request, rather than directly to the Ministry of Health, probably from what the minister has said, the budget 2022 is going to address. I think you should use the MA 63 argument and say that that is going to be taken into consideration, and also try to feed into the 12th Malaysia plan what is the development expenditure for your healthcare enhancement facilities in Sabah, and not to mention, not to leave out Sarawak as well. So with that, I think we'll move on. We have two other speakers. Dr. Kuljit is not online yet. I don't see his...
I'm online.
You're online? Okay, there's some. But Dr. Kuljit, if you don't mind, Dr. Kuljit, I'll give preference to our lady speaker first. Nadiah Wan, I think I've mentioned where you come from. And then, of course, when your name is mentioned, it brings to me memory of Nadiah Comanche, the great gymnast. So with that, I invite you to share your thoughts on this National Recovery Summit from a health perspective, that we have seen a lot of this in relation to public health and also private hospitals.
Thank you, Mr. Chairman. So actually, I think I'll keep my points brief. 3 major themes and 3 points each. The first one, I think, is that we as a business community and also as a country need to think about a reset. Now, Dr. Hishamshah has talked about how health is beyond the Ministry of Health, and we wholeheartedly agree with that. But what does that mean? Now, COVID didn't appear out of nowhere. It came and infectious diseases arise because we encroach on Mother Nature. And what are we doing in terms of viewing policies on environmental protection and planetary health, and how that would impact actually future pandemics and our ability to detect them early and also manage them. So that would be, I think, the first point I would bring up. Secondly, when we talk about investment in health, I would dare say that the investment in the past in terms of the medical services has been very good. The overall death rate in Malaysia from COVID is actually much lower than other even more developed countries like the US and countries in Europe, because we have been able to somewhat cope, I think, with providing the best level of care to patients who manage to get a bed. But I think that in order for us to deal with an infectious disease, the investment needs to go into the public health and primary care system. And this is really reflective of what even we do as corporates. Many corporates have actually stepped up to sponsor ventilators, for example. The question was asked about why we were not increasing the number of ICU beds. Actually, we have capacity to actually build field ICUs in a matter of days, but the problem comes with the manpower, the doctors, the specialists, the nurses who actually man those beds. And ICU care is the most expensive kind of care for us to give. And the only way for us to provide a sustainable response to COVID is actually to invest in primary care to prevent those cases from deteriorating and needing ICU care in the first place. And that means not just investing in vaccines, but also investing in contact tracing. So during this pandemic, a lot of the need was also, for example, laptops and handphones for contact tracers at the district health offices to call people to come forward for testing. But you don't see that, and it's not glamorous to donate to the district health office a few handphones, although I must say that some companies did step up. But it just reflects the prioritization of how we've been investing in healthcare, not just from a public sector, but also from the private sector. And I think this requires a reset. And the third part is also on non-communicable diseases. We know that if a person is already diabetic, their outcome from COVID will be worse. And so just working together as a society to have overall better health is actually important to the outcome of a person who survives a COVID infection and deserves something to be thought about. The second part is the public-private partnership, which I think Datuk Hishamshah has already mentioned, and I think it's a very important start. We actually put together this decanting process in a matter of weeks, and it has worked out really well. And it's just a matter of actually sharing the resources between public and private, particularly healthcare resources, which are very much constrained, as we talked about, in terms of manpower and things like that. So I hope that this new model of working will definitely continue. The second theme I want to talk about is the accountability of ourselves in the corporate sector. Now, in TMC Life Sciences Berhad, we have hospitals, we have branches, we have retail pharmacies, we have TCM. And it's really about, the people working there. We talk about ventilation. What does that mean? For example, companies should have an indoor air quality report assessment of their factories and offices. How many of us have actually done that? And know what is the quality of ventilation in our workplace? Because this is really important. COVID is an airborne disease. And just like dengue, where decades of education have resulted in people treating standing pools of water as a public health issue, indoor air quality is going to become very important for us to be able to live with COVID. And what are we doing about that? Secondly is testing. Widespread testing is really important because we need to break the chain of infection. We need to detect people with the disease and isolate them so that it doesn't spread. The testing has been, I understand the policies have come out for testing in the workplace, but it's really about making it commonplace in the community that everyone should have access to a COVID test. And perhaps it's an opportunity as well for Malaysian manufacturers to create these low-cost rapid tests, because it will definitely be something in place for the long term. And the third one is actually community transmission. So actually controlling the workplace environment is relatively easier, but once people go back home to their accommodation. And in particular, you know, workers in factories who may be sharing accommodation in very tight spaces, that increases the risk of transmission. So what are we doing around those areas? Coverage for dependents, because the dependents may be infecting them as well. So in the hospitals, we actually see that a lot of the infections in the employees are actually coming from outside of the workplace. And so therefore, we have to look at employees as a greater whole rather than just the people who are sitting in the office. And the last part is actually surveillance. Automation is really important, and MOH is definitely looking into this. Data collection as well as early access to care, and going back to the public-private, involving people like the GPs in helping to manage this will become very important. So Datuk Sri Iqbal, your question in the beginning of, even after vaccination, can we feel safe? Vaccination is not the silver bullet, and we have actually gone past herd immunity. And there are a lot of substantive changes that we need to make to the way we live in order to feel somewhat able to cope with COVID, this variant or any other future variant or infectious disease that may come up. So those are just my points. Thank you.
Oh, very good. I think you touch a good nerve of the whole spectrum of the problems that we are facing. Thank you for, there are a couple of questions, as I said, from what you have said. These basic environment-related issues, I think this is the essence, one of the points that was brought up both in Tan Sri Abdul Wahid Omar's opening remarks, as well as the minister, that in the long term, we have to address these issues, the environmental issues, the SDG compliances and things like that, and the planet itself. So with that, we move on to the, I won't say the last speaker, among the four is being slaughtered now, Dr. Kuljit. I think we have seen his face quite a bit, both in TV as well as in the printed media, is vocalizing and becomes a spokesman for the private hospitals. And I'm sure he would be able to share with us not only what Dr. Hishamshah mentioned about the public-private sector participation, in particular onto the COVID issues and so on. Over to you, sir, Dr. Kuljit.
Thank you very much. First and foremost, I would like to thank KSI again. This could be my third time participating, or maybe fourth time participating in this forum. I would like to talk about something a little different than what has been spoken earlier. We are talking about National Recovery Summit, and I'm going to give you a little bit of our ideas and our views from APHM on how we should start working on the recovery plan in the private healthcare. Now, the first part, which was mentioned earlier by Dato Hishamshah on the partnership with the government, we had a very successful 2 months in working with the government in the Greater Klang Valley in the process of decanting. And I think we find that even before, for the government to buy services from the private sector was the best option in order to reduce the total government spending on healthcare. Because in private sector, private hospitals, we have more private hospitals in Klang Valley than the public hospitals. And we have equipment, we have doctors, we have got the facilities. And I think that was a good move, and it has proven COVID has always have got its own silver lining. It has forced us to do so many things. And this was one way that we have tested that decanting, buying of services actually had helped out quite a bit. Now, we are in the belief that this should continue even during post-COVID. It will help both economies. It will help the private economy, it will also help the government economy, to help the government to save costs, and will also enhance some of the private hospitals who have now had a little bit of a setback in their economy as we don't see medical tourists, which I'm going to mention in a while's time. What we need now is a plan on realistic reimbursement on selectivity of cases that are decanted to the private sector. We are restricted with ceiling prices, which we can understand because during the emergency ordinance, there were certain cases that we could do in private sector based on the ceiling prices that were slated by the government circular. But we are able to do more for the government, to see more complex cases from the government sector. And if we would be able to readdress the reimbursement of certain selected cases, that we can actually take up more difficult cases in the private sector, so that we can further ease the burden of the government hospitals. We can bring down the waiting period of patients who wait for months and weeks, or even for simple imaging in order to get their treatment. And that can be done quite seamlessly in the private sector. So this is something that we can now, as the pandemic will start ceasing its constraint, we can now actually sit down and start discussing how we can move forward and make this not just in Greater Klang Valley, but also in other parts of Malaysia. The second part is that we should start discussing is to create green bubbles with medical tourism. We know that this pandemic is not going to disappear in the next 1 year, 2 years, 3 years. It might even be here for the next 5 years. Malaysia logged in close to 1 billion ringgit of revenue in 2019 just on medical tourism. And we were slated to do even better in 2020, but unfortunately, COVID has pushed that back aside. Now, we find that medical tourism would be the best way of starting tourism than the other tourism. It is safe, it is easily regulated. Medical tourists will come point to point. With the cooperation of Malaysian Healthcare Tourism Council, airlines and APHM, we should be able to start at least to some extent to get medical tourists into our country, because that would be one of our major source of income for the country. Of course, we can use norms like fully vaccinated medical tourists, keep them quarantined in our hospitals. And right now we do it, but it is very regulated, very restricted, only on chartered aircrafts and all that. So that is becoming a little bit difficult, but it is time for us to start looking at this. We have a lot of patients from the neighboring countries who are very eager to come back to Malaysia to get their treatment done. So I think that is something, as far as the recovery, economic recovery is concerned for the private healthcare, we should start discussing this. And using medical tourism, that will become a good impetus to then extend to the other types of tourism in small steps, but definitely this would be a way to test it out. The other point is we want to look at recovering the country's economy, and especially in the private healthcare. Private healthcare should be facilitated as an economic player with the government stakeholders, not as a competitor. Right now, we are working with the government pretty well in treating patients, as I mentioned to you just now on the decanting. We in private healthcare, we are not compulsorily there to give service to the public, because there is a very robust public service with very comprehensive and great accessibility to the common man. We have seen the way the public sector has managed the COVID patients. I think that's very commendable, very accurate, very, I would say they have done a fantastic job. The entire 2020, the government had managed COVID single-handed in the public hospital. So that shows that the government has got very good capacity, very good manpower in terms of very high level of expertise. So that doesn't mean that, that there is no option to the public to go to the public sector to get their treatment. So private sector is actually a good economic player. Patients, when they come to the public sector, we should be facilitated, and we should only be regulated on patient safety and the clinical process, and not on our businesses process, because this is a choice that is made by the public to come to the private sector to receive treatment on their choice. So we would want to be a player with the government in recovering the economy. And when we have a private sector which can give a level of care to those who can afford private sector, you can get a lot of investors coming back to our country to invest in many other sectors, when we can provide them a very high level care in the private sector, not hampering or making the public sector difficult, because public sector would be meant for the people who may not be able to afford private sector. So what I'm trying to say here is, let's facilitate private healthcare together as an economic recovery program, which will actually help many quarters of patients throughout the country. So this is our view, that we have achieved a lot working together with the government. And now as we move out of this pandemic, we would like to be players in terms of vaccination, private vaccination to those who seek private vaccination. We seek to the government that if they can open up various vaccines to the private sector, so that those public who would like to choose their vaccines, they're able to choose their vaccines in the private hospitals, especially the business community, business frontliners who need this vaccination when they do international travel. And we are also happy to look after COVID patients, which we are doing it in a small way. But the post-COVID conditions are quite a large amount, where the private hospitals are actually happy to look into the rehabilitative part of these patients who can afford private healthcare. So there is a lot of collaborative work that the private healthcare can do with the government. And the main reason is to ease their burden in the public sector, so that the public sector would be able to concentrate a lot of other public health issues, whereby the private sector can take up their burden on these other areas. As a whole, we have seen in the early years that when we had a robust private healthcare, our investors were very happy to come to Malaysia, because one of the things that they look in a country when they invest, one is a good healthcare system, number two is safety. And if you can achieve these two, you can have a very good avenue for investors to be attracted back again to Malaysia. And we can see this in our neighboring country, whereby these two factors has given a very high level of revenue to the country, because investors are happy to come when they find that you have got a very robust healthcare system. So that's about all I would want to say, because a lot of what I wanted to say has already been said earlier by my other speakers, but just to add on what might not have been mentioned earlier, as far as the private healthcare is concerned. Once again, thank you very much, Dr. Seri, and also to KSI.
Yeah, thank you very much, Dato Dr. Kuljit. I think there were very good observations that you've made. I think it goes in sync what Dato Dr. Hishamshah mentioned, that this health issue is not only the responsibility of the Ministry of Health. It is not public domain only. The private sector has been, and then we are fortunate in this country. We have got a strong private sector contribution towards this. But the fact remains that at the onset stage of the pandemic, I think this is what Dr. Kuljit is now saying, is that the private sector was not enrolled as part of the overall. Maybe it was the perception at that particular time, this pandemic will just go away. It's seasonal. I think some great presidents also said that, but we know that it is not true. And this has really come to the fruition. And then yes, is talk about medical tourism and what possibilities there for green bubble, for people movement between countries. And we can see that huge investments have been made. It is not social investment like the government, but this is private investment. And then we have to recover. And of course, we see private investment, private direct investments, foreign direct investments and all coming into. So that sums up overall. We have roughly about another, Zaim, is that right? We have roughly about another.
Can I ask one question, since he's the president Kuljit of the Association of Private Hospitals?
Yes, that's right.
I'd like to know what percentage of bed you provide for what do you call it, the COVID patient in your hospital?
Okay, it varies from hospital to hospital. It depends a lot on the capability and the capacity of the hospital, because we have got we got big hospitals, we got small hospitals, private hospitals. It also depends on the type of doctors that are practicing in the hospital. So we don't work on a percentage across the board. There are some hospitals can take up to maybe even 10 to 20 ICU beds for COVID, and then the smaller ones can only probably take about 2 or 3 COVID patients in the ICU. And similarly, it goes also in the normal ward, because private hospitals are not designed for pandemics. So we cannot mix patients with the other patients. So we don't have a percentage per se, but every private hospital we will accept COVID patients based on their capacity and their structure.
In the case of Sabah, there's an emergency situation. I think the private hospital should make special effort to try and assist the government to resolve the problem. Because the situation long term, I mean, you can plan the long term, but the immediate situation, people are dying. That is why I want to know what role can the private sector have in this situation.
We can work quite closely with the government, because in Sabah, you might have a number of private hospitals, but not all the private hospitals in Sabah will be equipped enough to look after patients in ICU. There are only 2 or maybe 3 major big private hospitals, and comparatively speaking to the Klang Valley, they are still considered to be small. And again, we also need manpower, because the manpower in private hospitals are actually pretty limited. But nevertheless, private hospitals are willing to sit with the state health department, and we are willing to work out something to help out together, as what we did in the Greater Klang Valley.
Yeah.
Maybe what you should do is to sit down with the state government, because I think the state situation is very dire at the moment, and see what you can do to assist. And also the charges. I mean, what are the type of charges? Can you charge a nominal charge for these people from the villages and kampong that have this problem?
I think we have to, I think Tan Sri has got a very good point on a specific state in Malaysia. I think Dr. Kuljit has already said, and earlier Dr. Hishamshah mentioned about the vulnerability of the healthcare system itself. Whether we were prepared for this pandemic and its impact as it has unfolded. Then you bring in the private sector, and Dr. Kuljit is now saying, we are ready to respond within constraints. I think not all private hospitals are equipped, but we must have a good cost recovery sort of a system. And he used the word, if I'm not mistaken, realistic reimbursements. I think this is where Tan Sri's problem comes in, because the private hospitals would say that we are not charitable in that sense. But if the government is able to provide us with realistic cost reimbursement, not the market rate, realistic cost reimbursements, then we are willing to play. And Nadiah also has said some aspects of this, and then between themselves. I think this is an ongoing problem. But immediately, I think what KSI and ECL would do is 2 things. One is this realistic reimbursement on selective phases. I think it should be a budget proposal, so that what Tan Sri Abdul Majid is asking about the problems in Sabah, not only in Sabah, there are other states as well. He pointed out only Sabah, but maybe Kedah is there, and then Sarawak is there, and so on. And if that is immediately, it is implementable. And I think that would be very good for the private hospitals and things together. And Tan Sri, so he mentioned about this pandemic related cost. I think we will take up this, and probably we should have, Tan Sri, some tax deduction for the pandemic related costs. If you are now putting all these costs to the businessman and the industrialist, the cost goes up, your profitability and your survival will be affected. So we see some benefit at least accruing to it. So we'll open up this for one or two questions. I see some of those people who are following online have given us some questions. And I've seen that the questions have been very clearly answered by not only the speakers on this panel, but also by the minister himself. So we need not have to put the questions back again and then get a repeated answer. If the panelists want to add one or two points that might have been missed, or during the discussions it has come up, I'm very open to give you an opportunity. Who is the taker? Dr. Hishamshah? Any points?
Well, Dato Sri, I mean, it has been a challenging journey, over the past 1 year. But just suffice to say that we are seeing the inflection point. There's light at the end of the tunnel. Believe me, I mean, there's a rainbow after the short rain. I think we are going to see some good times. But we have to remain cognizant that the vaccine is not the solution. As Nadiah pointed out, it's not the silver bullet. The society, Malaysians have to be, now be aware that we need to eventually live with the virus. And with this, we need to be, be content with having some social norms. It is not things, business as usual before the pandemic. BC is over. Now, after C, I mean, we need to be aware that it's challenging times ahead, and we need to meet, some consideration to the new norm that we need to adopt in the time to come. But looking at the trend, we are seeing some, indications that we are improving somewhat, and we hope that this is going to be improved further. But we must not let our guards down, Dato Sri. So that's what I have to say. We are in this together.
Yes.
Can I just add that
yes,
I think
Nadiah?
Primarily, I mean, we have seen the approaches a lot more stick sometimes than carrot. And I think that because we want to incentivize a change in behavior from an individual and also even at the business community level, perhaps similar to what we have done with the Green Building Index, we can tie some of these incentives actually to certain indicators that we wish employees and communities to achieve, and if they achieve certain indicators in compliance, that we would incentivize them rather than giving a black and white option of total shutdown or allowed to operate. So I think that perhaps we need to look at more sustainable ways to actually incentivize people to change their behavior, because otherwise it's we cannot go through, I think, cycles of shutdowns and lockdowns permanently.
Oh, that's a good point. Fortunately for this country, we have not got street demonstrations saying that why these restrictions, no lockdown, no mask wearing, and no vaccination also. I think lucky, we are very lucky with this. So finally, I don't say finally, over to country. Sukiamlai, do you have anything to add on at this point? A quick one.
I think important is we will treat this as endemic. The SOPs, the strengthened adherence to this is very important. Another one is the government also need to look into the cost for this compliance and regulatory compliance costs. And so the self-test kit cost, we still think that the current cap price is still at the high side. There are more room to be reduced so that all private sectors and the industries are able to implement using self-test kits, because only manufacturing and construction sectors are practicing. These are about 3.5 million workers are practicing. How about another 12 million workforce outside that are not practicing? So these are things that we need to encourage more people to have this self-awareness to check the pandemic these cases. So I think that the SOP is also very important that we need to simplify. We have too many SOPs.
Yes. The point is taken. I think you have mentioned it. I think it is important that FMM and the ECKL and KSI, maybe we sit together and look quickly on what we could now put up immediately for the budget that is coming in for 2022, some proposals based on the recommendations that has come, the industry perspectives and so on. I think we'll take care of that. Without much ado, maybe Dr. Kuljit, your final point with anything?
I think the important thing right now is I think we will have to just move on as what we have been seeing, that we cannot keep having lockdowns. The important aspect we need to further strengthen is education, educating our public on the need of vaccines and also how to protect us further. We do not want to have a situation like in the United States. Suddenly they have decided to remove their mask and then they have put back the mask. We should not make such mistakes. And we should also start considering whether booster doses are required, and we should make these decisions early, especially for healthcare providers. And if we miss that window period and our healthcare providers, frontliners, or even other frontliners, if they start getting infected and only then we start planning on our booster dosage, that we are going to miss the boat again, and we do not want that kind of catastrophe. So now we just need to fine tune our next steps. Let's not make mistakes, learn from the others. And I think that's what we need to do from now onwards.
Good point. Maybe we just a small takeaway for Dr. Hishamshah. This immunity, whether the waning of the immunity after 2 doses, this is a big question. And whether immunity that they are talking about is universal or it is ethnic or regional based. And then we have to study it from our own perspective and see, and maybe the IMR and other, which the minister was talking about, you will take it up and see how best we can boost the immunity, natural as well as through the vaccine and booster dose and other things. I think with that, we just pray that this COVID, I think what everybody agrees is that this COVID is not going to go away. It is going to be there. And then now people talking about endemic, meaning that it is going to be there just like the flu. Hopefully it is just like the flu, and then we will go to the private clinic to get a booster dose or whatever it is as the time comes. We pray that we will recover and then move on to 2021 in the next 3-4 months, and then into 22 strong and vibrant as we were before. With that, I would like to thank Dr. Hishamshah, Tan Sri Sotiamlai, as well as Dr. Kuljit Singh and Nadiah for your valuable contributions. And this has been a wonderful first session, which paves the way for the next 2 or 3 sessions, and then wonderful National Recovery Summit. Thank you very much.